Okay, let's dive into herniated disc treatments, what actually works according to the experts.
And it's a huge deal. Every year, up to 3% of us are dealing with this pain.
If you've had that kind of back pain, you know how confusing all the options can be.
So how do you figure out what's really going to work for you?
Well, one major review dug into 12 expert guidelines to get some real answers.
They cast a super wide net, searching through 6 major scientific databases to find a consensus.
And from all that, they boiled it down to 12 key clinical guidelines from around the world.
Their goal, to find some agreement in all the noise. So, let's start with the first steps.
Right, we're talking about the non-invasive stuff. No needles, no surgery. So what's recommended?
Okay, looking at this data, you can see a couple of treatments really stand out. Yep, NSAIDs, that's stuff like ibuprofen, and cognitive behavioral therapy got top marks across the board.
But here's where it gets tricky. For physical therapy or bed rest, the experts just couldn't agree.
Okay, let's level up to injections and other minimally invasive options. What's the verdict here?
And wow, look at this. The data shows a really strong agreement on one specific treatment.
We're talking about epidural steroid injections, but it's not so simple. It's all about the timing.
See, they're great for short-term pain relief, but for the long haul, the experts say no.
So what if the pain just won't quit? Surgery's on the table, but which ones are a sure bet?
Looking at surgical options, there's a lot of confidence in the tried-and-true procedures.
Things like open discectomy and microdiscectomy scored really high, again and again.
But for a fusion, it's a totally different story. It really depends on the patient's history.
All right, so after all that, what are the main things you really need to remember?
Okay, 3 big things. Strong consensus on a few treatments, proven surgeries, and a big gray area.
At the end of the day, the researchers say this is just a really complex field.
Which makes you wonder, what debated treatment today will be the go-to standard tomorrow?